Hello everybody. It's December 24th, Christmas Eve at Austin Eye. And I thought I'd just take you guys along in a typical day in private practice ophthalmology. So hope you enjoy it.
My focus within ophthalmology is cataract and refractive surgery, which is surgery to the lens, inside the eye, and the cornea, which is the front window of the eye. What you're watching now is cataract surgery.
This is our third case of the day, but this gentleman is having surgery to both the right and left eyes on the same day because it's elective surgery, so we call it same-day bilateral premium lens replacement.
We then introduce an instrument into the eye through a tiny 2.8 millimeter wide incision. This instrument has three functions that it can perform concurrently: infusion of fluid into the eye, removal or vacuum of fluid from the eye, and application of ultrasound energy to dissolve or emulsify the lens inside the eye. It allows us to remove the human lens, which is about 10 millimeters in diameter, through this tiny 2.8 millimeter incision.
Our practice is mainly focused on doing cataract and lens replacement surgery, so the vast majority of the patients you're seeing today, they either have visually significant cataracts or they are a little bit younger and they have to use reading glasses to refocus from far to near, or they use bifocals and they hate their reading glasses, they hate their bifocals, and they want to be able to see younger. So we do elective, what we call premium lens replacement surgery. And some patients, when we put in a man-made implant, it's rare, but they will not like the way they see. So sometimes we have to remove a lens implant that was inserted and replace it with a lens implant of a different design so they see more comfortably. So that's what comprises a majority of what we do surgically here at Austin Eye.
After dividing the cataract into 4 smaller pieces, we then use the phacoemulsification handpiece to dissolve and remove each smaller piece. The eye pressure is maintained because as we remove the lens and fluid from the eye, we infuse saline inside the eye to keep the eye pressure stable.
So the beautiful thing about cataract and lens replacement surgery is it's very impactful in a positive way on the patients, and they get really almost immediate gratification. So usually they'll come in, they can't see very well, they'll need glasses, or they have cataracts and it's obscuring their vision, and then we do a 8-minute surgery, in most cases about 500 seconds of surgery, and then they can see better within 24 hours and get back to a normal schedule. The surgery is almost bloodless. Maybe they'll lose a drop or two of blood. The surgery is super precise, clean. The patients come in, they're awake. The surgeries are all outpatient, so they're here in our surgical center for only about 90 minutes or so. So it's very quick and efficient and precise. And I really like that type of work. So we're starting our experience with this lens here. This is the Bausch & Lomb NV multifocal lens, and it's designed to help patients see full range, far, mid, and near. And we're just gaining some early experience with it. This is about my 8th NV lens that I've put in, and it seems to work well. Early impressions are it's a lens that's similar to the Panoptix and the Odyssey. And I'm going to zoom in on it. Has little rings in it, so patients may see a little halo effect. What's our axis supposed to be? 173. So 173 would be moving it a little bit. So it's designed to correct astigmatism and any misfocus. This gentleman only has one good eye. This is his only good eye, so we deal with that not uncommonly, where it has to be perfect. So we kind of practice perfection all the time, so when we have to execute, it's not a big deal. Let me adjust this alignment just a teeny bit here. Let's get a close-up look at this NV lens and brighten the light a little bit. Little rings in the lens give full range of focus, and those little notches here and here tell us how we're correcting their astigmatism. Double check the cornea. There's no blood loss, no sutures, and we're all done. You did great.
That's it.
Theo, remind me again, where do you live?
McLean, Virginia.
McLean, Virginia. Okay, got it. So your vision is going to be a little wonky today. It'll get better and better over the next 24 hours. We'll see this afternoon.
Yep.
How do you feel?
Good.
Any pain?
Just really mild, like irritation.
Okay, you did great. Remind me what bothered you about these lenses?
I had a drop shadow.
Drop shadow,
Couldn't see the computer or the phone very well. It all kind of ran together.
Okay, got it. So you just want better image quality.
Right.
Yeah, got it. So we've now removed your original lens. So that looks really perfect. Let me just double check everything. So this is a donor cornea. A person passes away and their cornea is removed and can be transplanted from one person to another. Dr. Medic gave me a Christmas gift. Much appreciated. Much appreciated. He understands my love of Doge, and he understands my love of Elon and Tesla, and I like Vivek too. These are some of the key members of our team. This is River Ficky. What's your role here?
I am one of the optometrists at Austin Eye. I am a ocular disease primary focus, and then primary care as well, contact lens, kind of everything you can think of for a primary eye care doctor.
And you see all our post-ops, right?
Yes, I do. I see 1 day post-ops, 1 month, in between that, just all the post-ops.
So if I do your surgery, in all likelihood, you'll see Dr. Ficky or one of our other optometrists. And we have Ellie and Kelly. What do you guys do here?
Ophthalmic technician.
Yes.
And how long have you all been working here?
5 months.
Like a year and a half.
Great. And then here we have Sarah.
I'm also a technician. I've been here for almost 3 years.
So we couldn't do it without these guys. So in reality, I do less and less each year because these guys do more and more for me every year. If a patient comes in, you guys really carry the workload. So you bring them back, you do most of the testing, do all the diagnostics, educate the patients. What else do you do? Everything basically. And then you just basically hand the patients off on a platter for me to go in, and I'll synthesize all the information that y'all have provided, and then we'll make a call between the patient and really the technician and myself on what's the best plan of action. And that system really works. And then we hand the patient off to Dr. Ficky. How long have you been working here?
Almost 3 months. I started October 1st.
How's it going?
It's so good. I love it here. I'm very happy to be here. Truly dream practice. So very happy.
Why is it a dream practice?
The people I'm working with are amazing. The other doctors that I'm working with are fantastic. Patient population is great. I get to have control of my own I guess, how I want to handle patients, how I want to take care of them. I definitely have full autonomy, and I have a team that I can turn to if I have any questions or concerns. Everyone's definitely looking out for each other for making sure the patient gets the best care they can. So definitely feel very just happy. And also this place is gorgeous, so it's like just aesthetically so happy to be here.
Remember that was good.
Anything else, ladies? Oh, Martha. You have a patient ready for me? All right, so we got to get back to work.
Go time.
All right, last patient of the day for me until Christmas, right? That's it. So here in our practice, we have a great team of technicians, nurses, administrative staff, ophthalmologists, and optometrists. We all get along very well together, and we have been very intentional in who we select on our team. But as a result, we really love working with one another, and together we do some pretty amazing work and help a lot of people. So I hope this gave you a small glimpse into life as an ophthalmologist in private practice. Thank you for watching. Bye-bye.